Are there physicians who simply say, you can't afford
Absolutely.
these drugs? We've got to stay with Part B, not Part D?
Absolutely. We have a lot of patients where their copay, even though it might be 10% of $10,000 is a whole lot of money every single month. So oftentimes we'll look for grants. We have a full-time person who only spends all her time looking for grants, and most of the time they make a little bit too much money to meet the cutoff, and they still can't afford it, and we have to change plans.
What is a copay card? I keep hearing this.
Oh, that's a commercial copay card.
What's that?
So the way that a manufacturer can help support the patient's out-of-pocket expense is through a commercial copay card that is only eligible for commercially insured patients.
All right, I'm getting confused again. Is this from the manufacturer? It is. And this copay card helps defray the cost?
For commercially insured.
What's the problem with the copay card? Why is it?
It's a conflict of interest.
Why?
Because the company, the manufacturer, is basically saying you don't have to pay your copay to the patient, and the way, from my understanding, I mean, in a doctor's office, we are physically not allowed to absolve a patient of their copay because the decision of the treatment needs to be in the hands of the patient.
I was going to say this.
And the patients need to be able to determine what they do and do not want to receive, and cost needs to play a factor in that.
Let me ask a very basic question that just occurred to me. If a manufacturer can afford to provide you with a copay card, couldn't that manufacturer just lower the cost of the drug overall?
Thank you.
Well, I
You're
think,
welcome.
you know, this entire pricing scenario is being discussed in Washington, and we've got a grand plan, and we're looking at international pricing index. I mean, suffice it to say that the research and development for all of the drug products, for the most part, the technology is from here in the United States. So our research is supporting drugs that are curing disease and helping patients live with chronic disease over the entire world.
I understand that.
So
to some
our
degree, we're
system,
paying a lot of the.
So our system
Yes.
is built on drug prices, price rebates, all of this factors in. There's the payer, there's the PBM. We can't pull out one segment of that and expect it all just magically to work. So I do, you know, it is frustrating that
Sure.
the drug prices are very high for our patients. And one way that manufacturers have found the ability to help patients as they can is through copay offset. So in the commercial space, it is a copay card. Now, for patients who can't use those, the government insured patients, there are 501c3 foundations, so the groups that you spoke of. So this is generally available to patients based on an economic need, a percentage of federal poverty level.
Well, again, that's at least across the board. And it's not for a particular product, right? This
is not. It's based on
right.
the disease
It's
state.
based on disease state and economic need,
Right.
which I would guess you like better.
Yes, although
Although what?
not entirely solving the problem.
Nothing entirely
Right.
solves the problem.
Not
right?
even close.
Well, and that's, you know, recently.
And
we
even these
found
funds are running out.
They're running out.
They're running out.
There's been a great deal of scrutiny around the 501c3 funds, and manufacturers have looked at those and the OIG rulings around those, and we're seeing it's a couple of things. So it's the funds aren't there, coupled with or lack of funds going in, decreased funds, and then secondly, there are more people trying to use these funds, right? So at our organization, 2006 was the first time we started looking at these types of funds. And, you know, we had half of a resource dedicated then. Today, we have 22 people full-time working on foundation support across all of our business, but a large percent is oncology.
I don't want to belabor this, and I do want to move on, but can you make the case that this is a chronic disease? We're now talking about people who are living not 3, 5, 8 years, but 10, 20, 30 years. They're in the workforce, they're productive, they're paying taxes. So to some degree, they're paying in tax money, what they should be getting out, at least in part, from the government
Yes,
to pay for
although
this.
the majority of the patients are, the median age is 70, so most patients are not working.
But
Maybe more
70 is
are
the
than
new
they
40,
were.
or haven't you heard? I mean,
Yeah.
people are living
No,
longer,
I
they're
hear.
healthier, right?
Yeah,
So maybe that's
they're
one
not
way to
coming in
justify
for
it.
infusions.
And the 70-year-old spent 40
Right.
years working
Right.
somewhere,
Right.
paying into
Right.
a benefit that, now they're being told, well, your out-of-pocket is $2,000 just to get started.